Zach, so you can. Thank you. Okay, hi everyone, welcome. I see a lot of familiar names and faces, but for those of you who don't know me, my name is Claudia Sartor and I'm Deputy CEO at the Global Mental Health Peer Network. And I will be your moderator for today's session or today's webinar on lived experience remuneration framework and on a stakeholders assessment tool for meaningful and authentic inclusion of lived experience. If you can just keep yourselves on mute, just to avoid any background noise. Thank you. Okay, so to give you an idea as to why we started and co-developed this framework is really based on the experience that we've had as an organization whilst growing. So initially we were advocating for the inclusion of lived experience into policy, discussions, narratives, and practice, right, in global mental health. And now we're not so much at that point where we need to advocate for that, because that seems to be now what's happening. And we've had to kind of take that step further and look at what's now trending and what's occurring. And what we did is we created a specialized unit in the organization called the Experts by Experience Consultancy Services Unit. So that came up as a form of income generation for our operations, right? But then at the same time to also empower lived experience advocacy leaders, right? For them to be part of service delivery, to be part of providing recommendations and advice to stakeholders, but at the same time having a fair compensation associated with that. Not for it to be, because we've had a lot of instances where stakeholders weren't sure how much was considered fair. Different areas, different regions have sort of different levels of what is considered to be fair. So we then thought about, okay, why not look at this as a focused initiative, which is something our CEO works on quite a lot. And together with health economists and one of our speakers today, we co-developed the framework and then an assessment tool to go with it. So without going into too much about that, I think it's just important that what we're trying to say is keep fair compensation there, treating people equally, but also empowering individuals and having that empowerment element that comes with it. So for today, we will have Charlene Sunkel, our CEO and founder, go through the document. If you have any questions or any general chats that you'd like to, or comments rather, please put it in the chat at the end. After Charlene and Kriti, who's our other speaker, will, once they're finished, you're more than welcome to put your hand up and we'll take on some questions. So to get straight to it, so we don't waste time. So again, Charlene, I think if you don't know her in the global mental health space, she is the giant. She's the champion of it, and we're all here to support her. And this is yet another thing that she's come up with and we've helped her with to develop. So Charlene will go through that. And then when she's done, Kriti, I'll move over to you, introduce you, and then we will take it from there. Charlene, over to you.
Thank you so much, Claudia. It's actually a very proud moment for us. We've been dreaming to develop this. And it took a while because, of course, as you know, with many things, you need funding. So we're kindly supported by Kokoro and Vital Foundation. So like Claudia mentioned, we worked with health economists. I led the project with one of the health economists, and our support staff came. We also included some researchers, and then established a lived experience advisory committee, and yes, some of the names. So it was really a huge team effort, and we've done this over a period of a year. So yeah, it was quite a lot of work, but we glad that we managed to do this within that time space. So just to look at frameworks, there are specific remuneration rates for people with lived experience, but it's important to note they vary quite widely and they're often not standardized. We also found several reputable sources that provide some guidance for compensation for people with lived experience, but most of those were from high-income countries. Even from a desktop research, we found quite a lot actually from Australia. So that was quite interesting, but there was absolutely nothing for low and middle income countries, especially Africa. But it is always important when we look at frameworks, and specifically a remuneration framework, it should always comply with local labor laws, and also international ethical standards, and of course, human rights principles. And that is also looking at fair inclusion of people with lived experience across all initiatives. Then initially we first wanted to develop a costing model. So that was the initial objective. Now, if we look at a costing model, that is kind of a set formula to provide remuneration rates. So we wanted to look at, similar roles that would, and compare that with lived experience roles. But there was quite a lot of obstacles in going that route. First of all, there was a lack of transparency where companies or stakeholders do not often share information about payment structures. And there's also significant disparities in remuneration across roles, organizations, but also demographic locations. So we took the route of a framework instead. So that for us was a more practical approach. And we kind of looked and focused it all around the principle of equal pay for work of equal value for lived experience roles. So that is also based a lot on the principles supported by laws, guidelines, strategies, and a lot of collective advocacy across the world. And it also aligning with that specifically, we focused on what exists out there, what are the gaps, and then also to propose a payment scale that is fair for lived experience expertise, who then contribute towards work of equal value, and kind of also in terms of other professional and stakeholder counterparts. Just to look a bit about what we found related to equal pay for equal work. It's quite interesting to note that it comes from like the Universal Declaration of Human Rights, where it specifically says everyone without any discrimination has the right to equal pay for equal work. Initially, equal pay for equal work was very much based on gender equality. So women needing to get paid the same as men in the same position. And that kind of broadened over time. And now we see it cuts across all forms of discrimination. And that, of course, includes in terms of race, ethnicity, disability, and other protective characteristics. So the modern interpretation of that places an emphasis on equal pay for work of equal value. So you can see it changed a little bit. And if we look the meaning of what does it mean, equal pay for work of equal value? So that means someone who's performing the same or substantially similar job or work duties requiring similar skills, effort, responsibility, and working conditions, and that they should receive the same compensation regardless of their gender, race, ethnicity, age, disability, and of course, other protective characteristics. So what are the best practices in terms of remuneration of people with lived experience who contribute to various sectors? First of all, it's equity and fairness. So that means people with lived experience need to be compensated equally compared to other professionals in similar roles. Then transparency and compensation framework. That means establishing a clear remuneration guidelines and also account for the complexity of roles. For example, we contribute to advisory boards as research collaborators, providing or conducting training or facilitating training. And then inclusion of costs beyond expertise. This is also a quite important one, because we found that stakeholders often don't consider the cost to the person outside of just paying for expertise. For example, if you invited to a workshop to come and contribute your lived experience expertise, and you need to travel, so considering the cost of travel, accommodation, meals, and we also found that there were reference made to childcare. And also when you go to virtual sessions or engagement sessions to look at data, so technology requirements for participation. Context-sensitive remuneration, that means like reflecting the local economic conditions, considering the currency differences and purchasing power. For instance, consultants from low and middle income countries should receive adjusted compensation that ensure parity with global standards. Somehow I went to the wrong song. Okay, there we go. Then streamlined payment mechanisms. So flexible payment mechanisms to reduce the delays or bureaucratic obstacles. And that means organizations or stakeholders need to set up systems for regular and international payment. Maybe to mention in terms of that, I just want to see what that also means in terms of payment structures. We find that there are issues around systems where people, for example, either a stakeholder can find that they cannot pay individuals, but they can pay organizations or vice versa. Some require organizations, even if it's a lived experience organization, require them to have, what do they call it, professional indemnity insurance, and that is a cost. So there's a lot of hiccups, and especially related to stakeholder policies that, should change to really accommodate the compensation of people with lived experience. Then also clear contract agreements, so formal contracts that clearly details the roles and the responsibilities, and remuneration must be clearly highlighted, and also to reduce potential for tokenism. Cultural shifts and advocacy for evaluation of expertise. So organizations can play an important role to advocate for the recognition of people with lived experience as experts in the field and to be equally valued as their professional counterparts. Capacity building and empowerment is very important. That is kind of where the peer network also fits in the work that we do. We run an empowerment and leadership development through peer mentorship programs to actually equip people that they are able to meaningfully and authentically be involved and contribute their lived experience expertise. But in any event, if a stakeholder wants to include people with lived experience, there must also be capacity building and empowerment from their side so that this person or people are able to meaningfully contribute. Okay, so just to speak about how we developed and what components were part of developing this remuneration framework. We've done a comprehensive desktop research, like I mentioned before, looking at what exists, what is out there, what are the payment rates other people are paying. We also did other researchers doing a review of relevant literature. We ran or conducted 2 surveys, one survey for people with lived experience, just to gather some information about what they get paid, what they see as obstacles, just kind of their feedback in terms of this, but also their recommendations. And then there's one survey we also did with stakeholders, kind of to also get kind of perspectives from their side on how they include people with lived experience. What obstacles do they actually encounter themselves? And also what recommendations they would make. Just to mention, both these surveys, the recommendations that were made by the people with lived experience and stakeholders forms part of the actionable recommendations that we set aside for this as well. We also took some insights that we gained through our Experts by Experience Consultancy Services unit, where we do have provide lived experience expertise to various sectors, as Claudia explained. And then also we developed a lived experience expertise self-assessment tool, and that has been tested with a team from GMHPN and revised accordingly. Just as a note to say that this framework, it's important to note that we still need to continue to refine this framework. This is not like the end of the project. We will continue to refine. So we're going to rely a lot on people's feedback in using this, what are the obstacles, and really look at how can we change it and adapt it to really make more sense and be more practically applicable to different sectors. And as we also know, the mental health landscape changes quite a lot. So it's inevitable that we do need to adapt continuously. Just some interesting, I can't, of course, say all the highlights from the surveys, but what was quite interesting is one question that we asked both stakeholders and people with lived experience was, are more sectors and stakeholders acknowledging the monetary value of lived experience expertise? Are there more changes in policy and practice that have adopted remuneration roles for lived experience expertise? From the stakeholder responses, quite a large component said, almost 70% said yes. People with lived experience were almost half, 50%, just over 50% noted yes. Some overview from the lived experience survey. I'm not going to go into too much detail. At the end, I will give you a QR code that you can scan just to find a bit more details about this project. So some of the obstacles that the lived experience participants highlighted in terms of remuneration for peer roles included lack of recognition and understanding. So people with lived experience still felt that there isn't much understanding and recognition for the value that they can bring. There's also the perception that they feel is that they are unable to add value as academic, compared to academic and professional qualifications. Then funding and budget constraints, we find that ourselves quite a lot in delivering services, that there's a limited funding and budget constraints, and then also organizations often do not allocate sufficient funding to compensate people with lived experience to be involved in their projects. Stigma and discrimination, I think, is a big one, and it always comes up everywhere. That is quite a big barrier. And then there's also a belief, which is similar to the other one I mentioned above, not capable of contributing effectively. Participants also highlighted some systemic and cultural barriers, that the traditional practices, cultural barriers within organizations also prevent integration of lived experience experts in remuneration roles. And there's also a lack of established frameworks and standardized rates for compensation. Tokenism was also highlighted as an obstacle, that many felt that their involvement is often tokenistic. Lack of government and organizational support was also highlighted, and that organizations often do not have policies and guidelines of how to fairly compensate lived experience expertise. And then awareness and education, that there's a general lack of awareness and education about the importance and benefits of involving people with lived experience. And inconsistency in remuneration, that there's no standardization. And of course, that people are often not paid adequately or appropriately. Maybe to mention, we found a lot of different payments means of when we did the survey. Some get, like, for example, vouchers, or some get very little compensation. But I'll speak about that in a little bit. Okay, so from the stakeholder results was also quite interesting to see the level of participation, how they include people with lived experience. Many indicated that they have ongoing and consistent involvement. Others indicated some time limited or periodic participation. Most actually indicated that they do provide remuneration for lived experience. The basis of remuneration was provided based on hourly rates, as I mentioned just now, maybe project-based fees or monthly stipends. That was kind of more mostly. We find there was quite a variation of what organizations paid. You can see from some of the figures here, those range from, okay, let me use the dollar amount, 27 US dollars, up to $190. That was more indicated from South Africa. And then between 20 to 50 pounds in the UK, and from the US, it was around $43. That's per hour. So the challenges in remuneration includes institutional limitations, lack of budgeting, and also difficulties in determining exactly what is fair to pay people with lived experience. Some organizations also face some issues around payment mechanisms and financial reporting requirements. That is also includes some of the issues that I mentioned around lived experience organizations requiring professional indemnity insurance and all those things that we don't really, it's not kind of relevant to the work that we do. Yeah, in terms of partnerships and collaboration, it was quite nice to see that many of the stakeholders collaborated with organizations, so almost 70% there, and they noted partners that they usually use. The more common ones was actually nice to hear, the Global Mental Health Peer Network and the National Association for Peer Support. Stakeholders also noted some limitations and challenges, financial barriers, lack of responsive training and capacity development, language inclusion, that is quite a big one that we also face quite a lot, and childcare support came up, yeah. Upfront payment mechanisms was also highlighted as a barrier. Their reporting requirements, financial and non-financial reporting requirements was also bottlenecks. And then obstacles to adequate provision, cultural limitations, lack of appreciation from lived experience. People with lived experience knowledge and institutional structures not geared towards, I think it should be regular payments. Yeah. So stakeholders often did not budget adequately. So that's kind of the gist of that. So our framework, I can swear I read this before. Yes, I did. Sorry. What I want to say maybe. So this framework that we developed, I'm showing you screenshots of how it looks. You will have access to this document, the actual document with these things. So as part of the remuneration framework, as you know, like people, we try to make the point that lived experience expertise, it is like an occupation, like a nurse, like a social worker, like any other professional researcher or whatever. So in that instance, in those occupations, it also depends. Your remuneration or compensation is based on your level of expertise, your qualifications, your experience, how many years you've been in the field. So that determines how much you get paid. So we try to kind of create the same thing here to get to something that can determine level of expertise. So we created based on kind of the different roles that people with lived experience take on. And I must maybe just also emphasize, we focus mostly on consultancy roles, getting involved in research. We did not focus much on peer support work and those kind of service delivery aspects. That was also kind of because of the time constraint, so we needed to focus. So the dimensions that you can actually try and test it yourselves if you lived experience to see what level of expertise you're in. So years of experience, the scope of your involvement, the level of your engagement and depth of your knowledge and understanding, the training and skills development you received, leadership and influence, public contributions and recognitions. Some people received accolades and awards for their work, which also counts in this instance. All these dimensions in the document that you can download from our website will have a description of each of these dimensions. So you assign yourself points and then you calculate the points. So level 1, which is your entry level, level of expertise, would be any score between 1 and 7, and then we go to intermediary and advanced, and then expert level. So there are, of course, also overarching competencies. You'll see in the document when it speaks about what rates according to these levels across different kind of areas of work or roles. There are overarching competencies that is also relevant to all of the roles that people with lived experience take on. And that is leadership roles where you're basically inspiring and guiding change while you foster inclusive and equitable practices. There's cultural competency. That means you are sensitive to different cultures and you understand the complexity of that as well within the context of mental health. Resilience and adaptability. You're able to manage emotional challenges associated with sharing personal experiences, advocating for system change. And then there's collaboration. And that means when you do service delivery or be a consultant, that also means how you need to be able to work together with stakeholders. Ethics and integrity, that's always to uphold confidentiality and ensure advocacy aligns with human rights principles. What I want to also highlight in terms of the framework, I spoke earlier about the cost, the out-of-pocket costs that also need to be considered. We also looked at the cost of data because that also varies significantly across countries. What was quite interesting when research and calculated this to look, for example, at a 2-hour Zoom meeting, typically uses 1.6 gigabyte to 2.4 gigabyte of data. So it's quite a lot. And in many countries, it's very expensive. So that also needs to be taken into consideration. And of course, when you use Zoom, you use more data when you have your video on, and when there's live streaming or when you share, what do you call it, presentations and so forth. And in person, that is also the cost of travel and accommodation, but there's sometimes also other things to be cognizant of. It's not only like transportation with like flights. There's also ground transportation because you need to get from the airport to wherever the venue is. There's sometimes not all meals catered for. There's visa fees. Some visa fees can be significantly high. And considering especially people from low and middle income countries where they need to travel to a high income country to kind of contribute their lived experience, expertise in a workshop or whatever, that currency exchange, it becomes extremely expensive for a person just to, for example, buy, I can maybe mention an example, in a high income country to buy let's say a bottle of, let's use a cool drink or soft drink, can be as much as providing a person in a low middle income countries for food for entire day or for 2 days. So just to kind of think about that aspect as well. Another thing that's also often missed is bank charges. Now, us like we work globally, so we provide services to other countries. So that means you get payment received from other countries, so foreign exchange, and for a bank to process those foreign exchange or those foreign funds, there's a cost to that. Typically, yeah, you can see we also did some research around, yeah, but in our experience, what we often struggle with is, let's say we do an engagement session and we are paid, let's say, okay, $20 per hour. If we get paid in foreign currency, the bank is probably going to take all of that. So we will not get any money. Just to be wary of that as well. The bank charges are really high for most of the time. And it's irrelevant of how much you get paid. If you pay a person, let's say 2,000 Rand or 20 Rand, you'll still pay the same amount for bank charges for foreign currency. I just want to, okay, you probably can't see it's extremely small, but just to show you how the stakeholder assessment tools look like. We developed this specifically to help and support stakeholders to see how effectively are they including lived experience expertise in their work, whether it's their project or whatever. They can actually use this tool, and it's got a rating scale as well, to see in various aspects of inclusion. And that goes from the recruitment phase, orientation and empowerment, how effective is the communication, support and resources, how is that provided? And that includes like compensation aspects. And are risks being managed, and how is that done? And then a stakeholder can calculate the scoring and see exactly where they fit into that. Yeah, so this is a stakeholder one. So it's pretty much based on the same questions. There's another tool for the people with lived experience involved in that stakeholders work. Pretty much the same, also scores. So then you can really compare from the stakeholder and the people with lived experience involved. Where does, how meaningfully and authentically has lived experience been included, and then really help stakeholders to develop strategies to improve different areas of inclusion. So you can find this. This is actually a service as well that we developed. This is just kind of a self-assessment one. When we do a service, we do have a more in-depth one. Okay, so I'm almost done. It feels like I'm talking forever. Okay. Actionable recommendations that we developed, and I mentioned that we took from the stakeholders and the people who have lived experience. So first of all, to really shift the stakeholder perspectives, to acknowledge the contributions and the value of contributions of people with lived experience, to also foster cultural changes in recognizing the monetary value, and also to implement the principle of equal pay for work of equal value, and to implement a globally adaptable remuneration framework that really looks also at the country context and also fair pay across the regions. Also to include provisions for covering costs incurred by people with lived experience, which I mentioned before, travel, data usage, and also bank charges. And then also in terms of budget, to adequately budget for lived experience inclusion, and also to have flexible payment mechanisms. And then to provide responsive training to equip people with lived experience to meaningfully contribute, and also to create a safe and stigma-free environment, develop clear strategies to ensure authentic engagement with people with lived experience, and avoid, of course, tokenism, to establish mechanisms for ongoing feedback and collaboration, to advocate for policy changes that institutionalize fair remuneration practices, and also to promote inclusive policies that prioritize equitable engagement and reduce barriers for participations. And then lastly, to invest in initiatives that demonstrate long-term impact of people with lived experience involvement, and evaluate and refine costing models. Okay, here's a scan. You can scan and you'll go to our website page, where you can kind of have, there's at the bottom a document that's you can page through that's more in depth. There's also a document, a PDF that you can download, which contains specifically the remuneration framework and the assessment tools. And by that, I just want to say thank you specifically to Kokoro and Vital Foundation for really making this a reality. And I think we all can benefit from it. But I also want to thank my staff for supporting me in this project, and also our lived experience advisory committee, and of course our researchers and health economists. And thank you very much. And over to you, Claudia.
Thank you. Does anyone need just another second of the QR code, or can we continue?
Oops. Sorry, maybe Zach, can you maybe put the link in the chat? That's maybe easiest.
Yeah.
Of that website page is the remuneration.
Cool. Thank you, Charlene. So yeah, I was just about to say, I'm sure you're thirsty now. That was quite a presentation. It was really nice to see from my side, or from, I'm sure, the team side, to see how this has actually panned out. Laura did put a really good comment about, you know, this is incredibly detailed and amazing, and it would be great to take like an example, you know, of it and go through the assessment tool. So maybe it's something we can think of that we could do as like a group, just so that there's some familiarity. It's new to us as well, right? So it would be great maybe to invest some time in that as well. Okay, so over to Kriti. I hope I don't bash your surname, but Kriti Vashisht. I know I've done it so many times, and I hope I got it right. So Kriti joins us. She's a researcher by profession, but has been with the peer network for years. Really one of such a superstar, and we value everything about her. And we thank you for being with us today, Kriti. Kriti is also part of that lived experience advisory group that Charlene had referred to earlier. And she's also a mentor to some of our new members that have joined, and helping them kind of get through the early stages of joining the network. So that said, I'm going to ask you 2 questions, Kriti, and then hopefully we can spark some conversation with the participants and see what happens from there.
Sure.
Right, so cool. First question. So I know we've said in our experience, we're seeing a lot of integration of lived experience in service delivery and research. I think research is probably one of our biggest areas, and policy. Are you seeing the same from your end in terms of research and policy and practice?
Thank you so much for the wonderful introduction, Claudia. It's always my pleasure to represent Global Mental Health Peer Network. I think it's so wonderful to listen to what Charlene represented and presented today. And what caught my eyes was like how she was focusing on that these remuneration framework is based on level of experiences, training and skills, and other sort of technical skills. And I was wondering in the whole process that is it also about like now kind of I think politicizing the very lived experience space, but it's not like that, because when you look at the skills and training, it's not promoting any sort of a PhD or a master's. It's always about training in human rights, training in your own lived experiences, honing your advocacy skill, communication skills, how you are being integrated and in a space when you are talking about your lived experience, because it's not about not presenting the raw lived experience, but it's also about how you are presenting that lived experience in a very influential and impactful space, and how you are doing that. So I really like that. Why I'm talking about this is because when we talk about research, and when we talk about service development, and when we talk about delivery, what I notice is that there are different types of people with lived experience. Sometimes they are from the field of mental health, like, or human rights, like I am from that field. And even if I have my own lived experience, I also have some sort of expertise in the area. But then you have lived experience people from who are living their life, who might be a CEO of a financial company, or maybe doing a banker job. So when you talk about all these things, you are talking about how you are including diverse stakeholders in the space. And it is very important. We do not want to be very restricted in the space for lived experience who are only from mental health experiences or from the human rights, even if that is a very important skill as you advocate for that. I definitely do see, and I can refer to your and Charlene article that you published in 2022 and 2023 about what are the recommendation and how people with lived experiences are being included in research or service delivery and development. That definitely has set the ground for government and other stakeholders to think about including the people with lived experience into the strategical and theoretical point of view. However, I think it's just a setting stage for us. We need to think about like how, in terms of policy, like a workplace, or maybe policy for someone who is a housewife, or maybe a house husband, and how they are operating in their life. Do we have any policies for them if they have a lived experience? So I think we really need to figure out how we are translating that information now. Now we have set the stage. We are utilizing our spaces and voicing out diverse opinions, but now we also need to think about now what we want from those spaces. Like we want policies in government, we want policies in school, we want policies in workplace, we want policies in medical facilities, etc. So that's my answer to the first question.
Great. Yeah, thank you. And I mean, I think it goes back as well to what I had said earlier, as we first started advocating we're first bringing a platform for people to share their voices, their perspectives. Then it kind of took another step. Then it was more advocating for inclusion into service delivery. And then we took it a step further again. So I think it's continuously evolving, and you're right. As we're starting this process, we need to start thinking about what else is there that are components of that we could look into and start setting the trend for that as well. So thank you for that. Then the second question is, and you can be brutally honest, do you think that this remuneration framework can accelerate advancement in integrating experts by experience across the various sectors, but in a meaningful and authentic manner?
I would say yes, and not because I really like Charlene, but I think I would say yes because how practically and how critically the framework has been designed. First of all, I really like the way Charlene talked about that this is not a starting only by like only the people with lived experience are talking about this framework. There is a review of literature. Then I think the team whole developed the survey for both the stakeholder and people with lived experience. So we collected that information. Then we are working with the health economists on this framework, and we discussed, like Charlene talked about, like how she discarded the idea of remuneration cost model because it wasn't very fair and equity. So I really like that framework, that how critical there has been and critical value while establishing and developing this remuneration framework, and also how there is always an intention to be sticking to the core value of being fair, being equitable, and not only in terms of the philosophical values, but also in terms of context, culture, what is the geographical location the person with lived experience is representing. What does that look like? What does remuneration look like? So I really like that intentionality while framing the remuneration model. And also, I think the people who have contributed in the framework, they are brutally honest about the framework as well, like how this is a continuous process of refining and evaluating the costing model, like that how the model is doing. Is it being representative of people across different experience from different geographical locations? So I think this set a tone that we are not just monopolizing this remuneration framework.
Right.
It's just that we are setting a stage, and we are and also this is one of the kind we do not have that sort of framework. And there is no framework to include people with lived experience and making sure that they are being paid. So I think this is definitely a good framework that we should stick to and continuously refining and evaluating it. I also like that how it's not only coming from a very economist perspective, but also from a very practical experiences, like bank charges. Like if someone from a developing country is getting $20, like maybe the half of the amount, or maybe more than that, is just being charged by the bank because of the transferable fees. So those kind of contribution as well. I think what I really, really liked about this framework was how, because it's very normal to think about how we are actually distinguishing and deciding that people with lived experience who is in the field for 1 year or 4 year, how are they getting the remuneration? I think very beautiful example that, this is based on the level of experience, how much you have contributed, and the skills. And not skills which are like hard to get. It's like it's not only. I really like that how it is a mutual process of developing the skills. So you are not only developing and representing your voice, but you are also developing these skills and learning and growing and maybe earning more. So I think it's a very practical, critically analyzed framework.
Thank you. So, and I guess then what you're trying to say at the end was also the empowerment factor, which is what we're always going on about, right?
Sure. Yes.
Yeah. Great. Thank you so much. So I think now I know this has been a lot for everybody to take in. Are there any questions that any of you may want to ask Charlene or Kriti, or if not questions, comments? Feel free to raise your hand and we can have a conversation. And thanks again, Kriti, for joining. Let's have a look. Okay, I'm not, there we go. Path and Laura, you guys were like same time. Who wants to go first?
Laura, you can go ahead.
Such a gentleman.
No. You go ahead, Parth. Yeah, please.
Thanks, this is very kind. No, I just had more of a comment than a question. I think this is such an interesting and this is such a needed framework, and I'm very, very excited that it's there. And I'm sort of looking at, the next steps as well as to how in global majority countries like in India, like the role of intersectionality in this kind of dynamic pricing in the framework as well, as to what happens when a country like India, which is so large, where you have certain cities where access to opportunity is more for certain people with, intersection identity markers that are more privileged. So how do we then ensure that intersectionality can be rooted in? So I'm very excited to see how this moves along, and I'm very glad that, this is an evolving document as well. Congratulations.
Thank you. And good point. And again, it's about this is a living document and it's just going to continuously be improved. So we'll come back to you when we need you for further information. Laura.
Well, I just want to compliment the team. Very excited about this. I think you really hit the nail on the head, Claudia, when you talked about the work that we've spent just trying to get to the table. Like that's really been years and years. And in many ways, it still is that way. I know in the United States where I live, it's not necessarily an assumption that we can go with that will always be engaged. And sometimes our advocacy is just when we find out that there's a process underway and just, getting 2 or 3 seats at a table, nothing about us without us has always been a real challenge here. So I just want to thank you for that. And I think that as you look at dissemination and packaging of the process itself, it would be great to have those two, have that other area of nothing about us without us, basic kind of empowerment and technical assistance tools, kind of, repackaged and maybe slightly updated, would be really a great, again, kind of a 2-in-1 kind of process. So just want to put that out there, but I just want to thank you and the whole group, and just explaining it is actually a challenge. So I give Charlene a lot of credit for keeping the pace on that and really helping us to understand, drill down, what some of the specifics are. So thank you again. Anything I can do to help distribute it through my network, I'd be happy to. So looking forward to that.
Great. Thank you so much, Laura. And good suggestions there. Thank you. Valentina.
Hi, everybody, and apologies for the camera that is not working today. My name is Valentina Yemi. I'm working at the University of Essex. I would like to say thank you for the presentation and thank you for the excellent tool and the excellent work. Really well done on that. My question to you is, how do you foresee organizations engaging with the tool, and whether there is already any organization that has committed to using the tool? Thank you.
Thank you, Valentina.
Charlene?
Yeah, Charlene, if you can, I could
What
answer
you
one.
look up for?
Sorry, because something happened with my lights that was just really bizarre. Like it went on and off. I don't know. That was weird. Yeah, so over to you.
Thanks, Valentina. Yes, I think the people who supported us, Kokoro and Vital Foundation, I think they are committed to it. It's very new. I mean, this is the first webinar we really have around this toolkit. I think the assessment tool is for stakeholders' inclusion of lived experience to kind of measure the effectiveness. Yeah, that came last month, I think. Yeah, we've completed that last month. So we will definitely, and also with your help, if we could disseminate this widely among organizations and stakeholders to really actively use it, I think it's very important, and to commit to that, because their feedback would be so essential in really making sure it's fit for purpose and that we can adapt it to make it really much more effective and to keep up as things evolve and you know, people engage with it. And I think especially people with lived experience also from your sides, if you play around with this level of expertise, look at the amounts allocated for your different levels and expertise. How does that work against compared to what is offered? I think in terms of, I think what we're going to see, I actually had some stakeholders reached out who felt, I'm not going to mention, who felt actually guilty that they don't fit because they saw the remuneration framework and the amounts, and they actually felt so guilty because they don't offer those amounts.
Yeah.
But it's not about that, because these projects were developed like, you know, like 3+ years ago. And lived experience inclusion, especially the remuneration component, hasn't been a thing really back then. So you can't expect of stakeholders realistically that now you have to do away with whatever amount you had previously and now follow this religiously. It will take time. I think the easiest way is new projects starting, to start using the tools and the remuneration framework going forward. And I think it's a mindset that needs to happen with that. I hope that answers your question, Valentina.
It does. Thank you. Thank you for it. And I'm very happy to support you. So let me know how I can best do it.
Thank you so
Very well
much.
done again. Very well done. I'm impressed.
Thank you. Appreciate it. And maybe just to add, there actually are a few organizations, again, maybe not sharing names, but that are keen already on wanting to use it. It is, we've actually, it's, I think through just the dissemination of this existing now, some have come to us to say, okay, now what do I do? How do I use it? And so there are calls being set up. So it's going to be good for us as well, again, because it's so fresh for us to see what questions come our way so that we can adapt as well. Edwin, I think you've got you next.
Yes, I think for me it's just a comment because based on the presentation, because it's the first time it has been presented to me by Charlene, or rather by someone else, and now I got to look at it not as a staff member or somebody like something like that, but as a person with lived experience, and it actually hits very different. It's actually a powerful document that I believe has all it takes. But the other most important thing, my second comment, is the continuous improvement. I initially I came from an organization where it was all about continuous improvement because we had the ISO certification. So it's always about, you know, the processes and documentation being, you know, being scrutinized or being checked so that they can be the best version they can be. So I think one of the best things I see for this framework is us, or rather we, acknowledging that this is not complete, it is not there yet, but it is a process of continuous improvement. And that says a lot, because what lived experience looked like in 2020 and in 2019, or going backwards, is very different from how it looks in 2025. So there's a lot of things that dynamics are changing. The mental health space is changing. So with that, I believe it is very appropriate for us to note that it is a document that has life, and we have to continue improving it based on what the mental health landscape you know, dictates as we go forward. Thank you.
Thank you, Edwin. Nice to actually see a different, I didn't even think about that, to see a different side of it, because you're part of the staff, then you've been through this with us. So really nice to hear that. Thank you. Anyone else? Oh, Kriti, did I see your hand up? Yes.
Yes, I think after listening to the conversation, I do have a question that's open to Charlene and other people who want to jump in. So I'm thinking that, yes, you know, there has been so much work done in establishing and developing this framework, but now I also see that how there are certain spaces where we need to advocate more. Like you talked about limited funding. There are like limited funding, budget constraint. Even sometimes stakeholders like funding agencies, they do not. They also need to recognize that how this is something that we want funding for. So if there is less funding, that maybe a researcher or who is getting the funding, they feel that this is not enough to pay for people with lived experience. So we need to also advocate in front of funding agency. And also how you talked about institutional limitations, like for example, certain institution, like for example, in my own, if I do some sort of research and paying the participants, and even if they are expert with a lived experience, how you are going to advocate for that? Because sometimes they also see that you are going to pay participants, that's going to influence your research results. So I think we need to advocate on so many levels. And how do you see that advocacy go when we are presenting this framework to the broader community?
Good question. There we go.
Good
Charlene, I see you
question. Okay.
unmuted. Yep, there you go.
You asked a very long question. I just need to get back. Oh yeah, okay. Yes, with a funding component. I think what is really nice is one of our supporters, Kokoro, is a network of funders. So there is already that space, that vehicle to really get it from that side. We're already involved in helping funders, quite a few donor organizations developing their strategies. And that's also where we have a foot in to advocate for these things. But what I also want to say, if you look at research, Wellcome Trust is also noted in this project as a best practice model, because Wellcome Trust places a huge emphasis of including people with lived experience, but also to equitably and equally remunerate people with lived experience. So I think there's already that established partnerships with funders that we have and with research, institutions. I think it will be a slow process for some, but I think if these big organizations who are already best practice models are really implementing it, are kind of role models for everybody else to follow in their kind of to do the same practices. And I think that is a good way. And I think another way where we also can advocate a lot is at conferences, because that's also where researchers are, and kind of to help and teach, educate them how they can use this and also how they can advocate for remuneration. All research institutions need to see the value, the expertise of the person rather than a subject of research. I think that mindset is important to actually get there.
Thank you so much. That's a fantastic answer.
Yeah. And Path has also just made a comment, basically agreeing with Kriti, and it's imperative to share an advocacy strategy, and it really is. So this is some great feedback. Thanks, guys. Sandra, if you have to.
If I have to.
If you have to, jump in, yeah.
I have to. Just a comment. I know this is specifically for funders and researchers and academics. It's a framework that they can use for their costing. But from a lived experience perspective, I do feel it's necessary to say that as someone with lived experience, it's also our responsibility to capacity build and get as much resources as possible, because it aligns with this framework. It's not all on the funders, it's not all on the external bodies, etc. If you check the scaling system, sorry, I don't know what to call it, but there's certain things, there's mentorship programs you can get involved in. I know it's specific to the GMHPN, there's a lot of things we offer internally, but there's also lots of things that are available externally. And even if you're not a GMHPN member, on websites, on service user movements, etc. So as much as we want to be respected and be recognized as equitable partners, we also need to take those steps to learn as much as we can within the space as well. Not watering down our experiences, they're always at the forefront. But at the same time, to be able to speak the language both ways, if I can put it that way. So I just wanted to mention that from a lived experience perspective. Thanks, Claudia.
Thanks.
It-
So sorry, I keep Claudia. Sorry.
Oh, well, go, it's okay. Okay, great.
But just before the thought escapes me, I'm actually glad, Cassandra, that you brought that up, because I also feel that from lived experience expertise, if you really want to be valued, you also need to, to be seen that this is an occupation, you're an expert now. And that comes with responsibilities. You need to have professional conduct. If you are contributing, you need to be on time, you need to give your best, all of those aspects, you need to be a professional then. I think that mindset from people with lived experience is absolutely critical. Otherwise, all this that we advocate for is going to be demolished.
Absolutely. Yeah. Thank you. Edith, see your hand is up.
Yeah, for me, it's just a quick comment. From the perspective of someone with lived experience, I think it's a really important initiative, because it then allows us to be fully aware of the value of the lived experience and the respect it deserves. Because I can tell you, if I was not privy to this conversation and I was invited to, a project where they needed my insight, I would have been very happy to just walk there and provide it for free. But now I understand, I have a valuable contribution that deserves recognition and fairness. So yeah, I just really needed to say, I commend the team for this initiative. Yeah.
Good. I'm glad that's, you took something from this that helps you, with your future as well. That's amazing. Thank you. Okay, so Charlene, we have a few more minutes, but I don't know if anyone else has any comments, or you think we're good to close.
Yeah, but there's nothing more, but if anybody afterwards want to know more or have any questions to ask around that, or make comments, or even if you want to offer some help in disseminating or give ideas, please feel free to reach out to me. Shall I maybe put my email address in the chat? Yeah, and otherwise then we can go GM.
Did you get it? Okay, cool.
You got it. It's done. Yes,
Great.
thank you.
Okay, so big thank you to you, Charlene, and Kriti. Thank you for joining. And to all our participants, thank you so much for your time and for hearing us out. And here's to a bright future that we're all creating together. Take care and have a good week.
Take care. Bye.
Thanks, guys.
Have a
Bye.
nice day. Thank you. Bye.
Thank you. Bye.